हेलो एवरीवन। आज मैं डॉक्टर भूषण पाटिल सर के साथ में हूँ, जो एक रिनाउंड ईएनटी स्पेशलिस्ट हैं यहाँ सेक्टर 47 गुड़गांव में। उनके हजारों या लाखों में पेशेंट्स होंगे और आज हम उनका व्यू जानना चाहेंगे कि वर्ल्ड हियरिंग डे पे वो आप लोगों को क्या मैसेज देना चाहते हैं।
Hello everyone. Thank you Hem for inviting me today for this podcast. And this year, the World Hearing Day, which is being celebrated every year on 3rd of March, 2025, we have the WHO normally gives a theme and it takes care of this event. This year, the theme is the changing mindsets, empowering yourself to make your ear and hearing care a reality for all. I would specifically like to emphasize this year, specifically in case of youngsters who are using wearable gadgets on their ear, which is tremendously affecting their hearing power. They are not realizing that it has a negative impact on the nerve which carries sound from ear to the brain. It's a very sensitive nerve. God has given us a very delicate structure inside which processes the sound which goes inside your ear, and that processor processes it and it sends it to the brain. Because of the constant abuse to the ear because of these wearable gadgets, not only the physiology of the ear canal changes, but it affects the hearing nerve tremendously. The sound is one of the factors. Loud volume gadgets on the ear damages the minute hair cells which are there in the inner part of the ear, and unfortunately this damage is irreversible, and we as ENTs feel helpless when these youngsters come to us with permanent hearing loss. To give a brief, I would say in the ear canal there is an air column normally which is there, and that air column has a particular temperature, moisture and humidity level. But the moment you block the ear canal with a gadget, that parameters of that air changes, and the parameters which are optimal for the nerve, they get affected, and this again causes hearing loss in these people who use these gadgets extensively.
And we are also saying that people are not understanding that what ear hygiene they should maintain. So is it that only protecting from external devices is one ear hygiene, or there should be more things to be taken care of?
Ear as such is a zero maintenance self-cleaning organ of our body. It doesn't require any maintenance. You just don't abuse it. If you don't abuse it, then it will remain healthy. Yes, use of these cotton buds which are available in the market is to be discouraged because that causes infection more. Plus, I would say the way we have a whole body checkup system in hospitals, where normally once in a year you undergo some blood tests, some x-rays to get your body checked. In fact, even the eyes are checked in these annual health packages. Somehow ear is neglected. So I would request everyone to get even their ears checked once in a year if they are planning to get the health checkup done. So that is again a part of a hygiene, or you can say a preemptive care of the ear that you can take.
There is a lot of social stigma. People are finding that they are having difficulty in daily life due to hearing problem. Still, they don't consult at initial stages. When the situation worsens, then they will come to you. So what would you recommend them, that how can they understand the early signs of hearing loss and how early they can come to you so you can mediate and give the best treatment possible and reverse the hearing if it is possible?
Maybe you have put two questions in that. Yeah. One is the stigma associated with hearing aids. Yes, I agree. Even though people know that they have hearing loss, but there is a stigma, at least in our country, it is difficult for them to accept. People always say, what will others think? I normally in my practice say, don't think of others because they are not thinking about you. You will realize this later in your life. Live for yourself. So if you have hearing loss, you should go in for hearing aids. And with now latest technologies, you have almost invisible type of hearing aids. Even if you are worried somebody would notice, that's like rarely happens nowadays with new gadgets, this new technology hearing aids. Rarely people makes out whether you are wearing it or not. Second thing, yes, even if you feel that you have slightest of hearing issue, you should get it tested. At least in cities where all the facilities are available, I would advise each and everyone, you should get your hearing tested regularly. As I said, once in a year. And in between also, if you feel there's some kind of a difficulty, you should consult your ENT doctor.
So I request everyone who are there in Gurgaon, if anybody has difficulty with hearing or ear, please visit Sector 50, Gudath, first floor, and consult Dr. Bhushan Patil, sir. Thank you.